Good afternoon, one and all. A warm welcome to you all for the live phone in program on Autism Awareness organized by the All India Institute of Speech and Hearing, Mysuru. Today, we are here commemorating World Autism Awareness Day as well as Autism Awareness Month. In the year 2008, the United Nations announced April 2nd to be observed as the World Autism Awareness Day. Since then, every year, April 2nd is being celebrated to make all of us aware about a neurodevelopmental disorder that distorts communication and social interaction skills. What is the importance of this year's celebration in regards to Autism Awareness Month? It aims at helping individuals with autism to claim their dignity and self esteem and be an integrated and valued member of the society, which is very much required as they are discriminated at each level of their life. So, with this aim, this year's theme of World Autism Awareness Day is transformation towards a neuro inclusive world for all. So, with this program today, we are making an attempt to eradicate the barriers and help them to be one among us by accepting them, supporting them, and advocating for their rights. You may call us at 0821 250 2530 to ask your queries, or you might also type in your questions on AIISH Mysore Facebook page as well as on AIISH YouTube channel where this episode is getting live streamed. I, Dr. Amulya P. Rao, Assistant Professor in Language Pathology, AIISH Mysuru, will be moderating today's session, and we have two experts with us from the field. Dr. Jayashree C. Shanbal, Associate Professor in Language Pathology, Head, Department of Speech Language Pathology, as well as Chairperson of Autism Spectrum Disorder Unit. I welcome you, ma'am.
Thank you.
We also have Dr. Priya MB, Assistant Professor in Speech Pathology from Department of Speech Language Pathology, AIISH Mysuru. I welcome you, ma'am. So, let's start with our session. Awareness about autism is gradually increasing among common people. However, there are still many unaware about it. So, Dr. Jayashree C. Shanbal, could you please tell us in actual what autism spectrum disorder is?
Yes, let us know a little bit about what autism spectrum disorders is. Autism is a neurodevelopmental condition basically, but if you look at this condition, it is not just called as autism now. We put it under the umbrella term as autism spectrum disorder for a very basic reason that you will see there are various types of autism and autism-like disorders as well as with different severities. So, understanding what autism spectrum disorders is from the triad symptoms that we commonly see. First one is your social communication skills. So, generally, you will see that these children with autism spectrum disorders have problems interacting with people, they have problems communicating to people. So, a lot of times you will see that these children remain aloof, which means they don't mix with other people. A lot of times, not even with your family members or their peer groups or even friends. The other very striking symptom that you're going to see is that these children have stereotyped repetitive behaviors. Now, what are these stereotyped repetitive behaviors? That means these children generally you see that they have behaviors like they're constantly banging their head, okay, repeatedly, or they're tearing pieces of paper, or they're constantly moving a car, okay. So this is acceptable probably till a particular age, but beyond a particular age, these behaviors are supposed to become more meaningful. But you will see that these children are doing it very non-meaningfully and very repetitively. So these are some of the common symptoms that you see in autism spectrum disorders. So when I'm talking about autism spectrum disorders, you might find that there are some kids who are also low functioning as well as high functioning disorders. So when you see that they are low functioning, you'll definitely see that these are kids on the severity of the spectrum, the highest severity of the spectrum, while the high functioning generally have good intellectual functions. Okay, so their cognitive functions are generally very nice. Yeah.
Okay. So as ma'am said, now she described what autism spectrum disorder is. But many people common people, they have a lot of myth about this autism. So, what is your take on that?
Probably, as we said, as autism is heterogeneous, so are the myths, and there are a lot of myths about this particular condition. I think the biggest myth of all is that autism is a disease, okay? And people look for a cure for it. So the fact is, it is not a disease. It is not something that needs to be cured. It is a developmental disability, and children with this condition would have difficulties in social interaction, social communication. Okay, and these are their problem. But it definitely is not a disease. Also related to this myth is another thing that vaccines cause autism. Okay, specifically, the MMR vaccine has for a long time been purported that it leads to autism or is one of the causes, but that is again not true, and there is no scientific evidence to support that. One more myth related to autism is about the parenting style. It's often assumed that bad parenting and poor parenting styles can lead to autism or is one of the causes of autism, but that is not at all true. In fact, it was so bad that terminology such as refrigerator parents or cold parents, refrigerator mother was being used to describe the caregivers of these children. But it definitely is proven that the parenting style has nothing to do as the cause of autism. Again, they believe that children with autism just cannot learn. It's not true. As ma'am was just saying, within the group of autism spectrum disorder, there are children who are high functioning and who are low functioning, which again means to say they have different learning abilities.
Correct.
Not all children with autism spectrum disorder are also having intellectual disabilities. No, it might coexist, but it definitely is not true that every child with autism or who are on the spectrum have intellectual disabilities. And people feel that they do not have any emotions. Again, that is not true. They do have emotions just like you and me, but it's just that they have difficulty in expressing it the right way at the right time. So these are some of the common misperceptions or the myths that exist about autism.
Okay. Ma'am, as she was saying, common people have a lot of myths on this. And now in Google, we get to know so many information, and parents have this tendency to look for, okay, my child is not making an eye contact, my child is not speaking to me, so my child is not responding to me. So let me Google out. So they Google out and they have their own perception about, okay, my child might be having autism, though it might not be the chance. So can you just let us know what are the red flags that the parents have to look for in identifying, and how early can that be identified?
Yes, so let me just talk about the general, characteristic traits that they can look out for as an early signs. There's been a lot of research that's happening in this area right now. Earlier, we thought that autism probably could be diagnosed only beyond 3 years of age, and especially when children get into schooling. Okay, so that's where the teachers would be able to tell the parents, looking at all the other children, that look, your child is not the same as the other children. Okay, so but now the notion is not about kind of looking out for those after beyond 3 years or waiting till the school period. There are some very early signs which they can actually look out for at home itself. Something very simple that I can talk about is social smile. So if you watch babies now, the it's just a week or maybe a 10 days period after birth, you'll start seeing that the baby has started smiling at something. Okay, it may not be always at the mother, but the child actually starts showing some kind of smile. After 10 days or after 2 weeks, within a period of 1 month, you will see that the baby is already smiling at the mother, which means it is more associative and it is meaningful. So if you watch these children with autism, even beyond that, even close to 3 years also, these children with autism are not looking at people's faces, they are not looking at smiling, okay, or you will just see them randomly smiling at something, okay. So this is the first sign that they can actually look out for, and this has been found to be almost 90% predictive of whether child can get or the child can move towards the spectrum. Okay, that means it's such a strongest predictor out of all the signs that we see. That is your social smile. So, which is almost the beginning of any social interaction, I would say. And another thing that you would want to look out for is the communication behavior. So, a lot of children with autism, you will see that at least, you expect that when a child is growing, they should show some non-verbal communication. But in children with autism, you might see that even the beginning of non-verbal communication is highly delayed, or it might be deviant also. It's not the same the way the other children of their age would pick up. So when I talk about non-verbal behaviors, there are signs like, pointing, what you call as dietic gestures. Okay, so whenever a child wants something, it is just pointing at something. So this even babies can do much earlier, even before 6 months of age. A lot of times it's not a very clear pointing, but it's more, a palmar pointing. But you can still see that the baby tries to orient itself to its want or its needs. So that is the non-verbal communication you're expecting. But this non-verbal communication is not seen in a child with autism. So that is a very significant sign that you have to look out for. Obviously, you will see that a lot of children with autism will have delay in their language skills, verbal language. Okay, so ideally you expect now in the current trend that by at least 10 to 12 months, that is by 1 year for sure, a child is supposed to say a word, a meaningful word. And if a child is not saying that word, then there must be some indication of a risk.
Correct.
Okay, so this is one thing. Another thing is now research has come out with a lot of especially eye gazes. These children with autism don't look at human faces. They don't. They seem like they're not interested in human faces. So that's why I was telling you, less than 1 month itself, when a baby is already trying to look at the face of the mother and smiling, that is a very strong sign. While you don't see that children with autism doing that, they're mostly inclined towards looking at objects, but not really human faces. So these are some of the red flags they can definitely look out for as early as even 1 month of a baby being born. So that's one thing. Another thing that I'd like to say is the question about as early as possible. So now research that I'm talking to you about, the current research in India has already come up with certain strong early predictors less than 1 year of age itself. So based on that, I was just telling you that how you can look out for certain red flags. So my urge to the parents is, don't wait for the child to go till the level of schooling or even the preschooling, and don't wait for the teachers to tell you. Try to look out for these signs at home, and parents need to observe. That is what is important, whether they're typical children or not. I think observation of a child's behavior will give a lot of clue about parenting to them. That itself, will let them know that whether their child is growing appropriately or not. And the rest is, if they suspect, they have to take them to the professionals.
Okay, so as ma'am suggested, so once they've identify these red flags at the early years, whom they are supposed to consult on a first go?
Just like how Dr. Jayashree was mentioning, signs can be seen, or some of the red flags can be seen at a very young age, much lesser than 1 year of age, and definitely much lesser than 2 years of age. So during this period, parents are definitely in constant touch with their pediatricians, because kids are being taken regularly for their immunization, vaccinations, and all of that. So if the parents notice any of these red flags,
We'll just take this call and then. ಹಲೋ ಹಲೋ ಕೇಳಿಸ್ತಿದ್ಯಾ?
ಕೇಳಿಸ್ತಾ ಇದೆ.
ಹೇಳಿ ಮೇಡಮ್, ನೀವು ನಿಮ್ಮನ್ನ ಪರಿಚಯ ಮಾಡ್ಕೊಂಡು ಹಾಗೆ ನಿಮ್ಮ ಪ್ರಶ್ನೆ ಕೂಡ ಕೇಳಿ.
ನನ್ನ ಹೆಸರು ಮಾಳ್ವಿಕಾ ಅಂತ ಹೇಳಿ, ಐ ಆಮ್ ಫ್ರಮ್ ಮೈಸೂರು ಅಂಡಿ.
ಓಕೆ.
ನಮ್ಮ ರಿಲೇಟಿವ್ ಒಬ್ಬ ಮಗ, ಲೈಕ್ ಈಸ್ ಅ ಬಾಯ್, ಅರೌಂಡ್ ಒಂದು 3-4 years. ಈಸ್ ನಾಟ್ ಸೋಷಲೈಸಿಂಗ್ ಮಚ್. ಅಂದ್ರೆ ಹಿ ಲೈಕ್ಸ್ ಬೀಯಿಂಗ್ ಅಲೋನ್. ಮತ್ತೆ ಜಾಸ್ತಿ ಮಾತಾಡಲ್ಲ. ಇವನ್ ಮಾತಾಡ್ಸಿದ್ರು no much, like he's like in his own world.
Okay.
So, is it like autism or something like that?
ಈಗ ನಮ್ಮ ಜೊತೆ ನಮ್ಮ ಎಕ್ಸ್ಪರ್ಟ್ಸ್ ಇದ್ದಾರೆ. ಈಗ ಡಾಕ್ಟರ್ ಜಯಶ್ರೀ ಅವರು ನಿಮ್ಮ ಪ್ರಶ್ನೆಗೆ ಉತ್ತರ ಕೊಡ್ತಾರೆ.
ನಮಸ್ಕಾರ ಮಾಳ್ವಿಕಾ ಅವರೇ, ಕೇಳಿಸ್ತಿದ್ಯಾ?
ಹಾ ಕೇಳಿಸ್ತದೆ.
3 to 4 years ಅಂತ ಹೇಳಿದ್ರಿ ಅಲ್ವಾ? ನೀವು ಒಂದು ಕೆಲಸ ಮಾಡಿ, ಈಗ ನೀವು ಮೈಸೂರಲ್ಲೇ ಇರೋದ್ರಿಂದ ನಮ್ಮ ಸಂಸ್ಥೆಗೆ ಆ ಮಗುನ ಕರ್ಕೊಂಡು ಬನ್ನಿ. ಯಾಕೆ ಹೇಳ್ತಾ ಇದ್ದೀನಿ ಅಂದ್ರೆ, ಕೆಲವು ಸತಿ ಪೇರೆಂಟ್ಸು ಚಾನ್ಸಸ್ ಇರುತ್ತೆ ಅಬ್ಸರ್ವ್ ಮಾಡಿದಾಗ ಓವರ್ ಎಕ್ಸಾಜರೇಟ್ ಮಾಡ್ತಾರೆ, ಅಥವಾ ಇಲ್ಲ ನನ್ನ ಮಗುಗೆ ಏನು ತೊಂದರೆ ಇಲ್ಲ ಅಂತ ಅನ್ಕೊಂಡು ಇನ್ನೇನು ಹೋಗ್ತಾ ಹೋಗ್ತಾ ಸರಿ ಹೋಗ್ಬಿಡುತ್ತೆ ಅನ್ನೋವಂಥ ಪೇರೆಂಟ್ಸು ಇರ್ತಾರೆ. ಯಾಕಂದ್ರೆ ಅವ್ರಿಗೆ ಇದರ ಬಗ್ಗೆ ಹೆಚ್ಚು ಮಾಹಿತಿ ಇರೋದಿಲ್ಲ. ಆಯ್ತಾ? ನಮ್ಗೆ ಇನ್ನೂ ಸ್ಪೆಸಿಫಿಕ್ ಆಗಿ ಇನ್ಫಾರ್ಮೇಶನ್ ಬೇಕು ಆ ಮಗು ಬಗ್ಗೆ. ಆಯ್ತಾ? ಉದಾಹರಣೆಗೆ ಅವನು ಮಾತಾಡಿದ್ದು ಎಷ್ಟನೇ ವಯಸ್ಸಿಗೆ ಮಾತಾಡಕ್ ಪ್ರಾರಂಭ ಮಾಡ್ದ, ಅಥವಾ ಅವನು ಫ್ಯಾಮಿಲಿ ಮೆಂಬರ್ಸ್ ಜೊತೆ ಬೆರೀತಾ ಇದ್ದಾನ, ಅಥವಾ ಅವನ ಪಿಯರ್ ಗ್ರೂಪ್ ಜೊತೆ ಬೆರೆಯಕ್ಕೆ ಅವ್ನಿಗೆ ಆಗ್ತಿದ್ಯಾ, ಅಥವಾ ಅವನು ಬೇರೆ ಯಾವ್ದೋ ರೀಸನ್ ಇಂದ ಅಥವಾ ಕಂಡೀಷನ್ ಇಂದ ಬೇರೆ ಮಕ್ಕಳ ಜೊತೆ ಬೇರೆಯವ್ರ ಜೊತೆ ಬೆರೀತಾ ಇಲ್ವಾ ಅನ್ನೋವಂಥದ್ದನ್ನೆಲ್ಲ ನಾವು ತಿಳ್ಕೋಬೇಕು. ಪ್ಲಸ್ IQ ಅಸೆಸ್ಮೆಂಟ್ ಮಾಡ್ಬೇಕು ಆ ಮಗುಗೆ. ಆಯ್ತಾ? ಅಂದ್ರೆ ಇಂಟೆಲಿಜೆನ್ಸ್ ಅಸೆಸ್ಮೆಂಟ್ ಮಾಡಬೇಕು. ಅದು ಮಾಡಿದ್ಮೇಲೆನೆ ನಾವು ಕರೆಕ್ಟಾಗಿ ನಿಮ್ಗೆ ಹೇಳ್ಬೋದು ಅದ್ರ ಬಗ್ಗೆ. ಸೊ ಮೈಸೂರಲ್ಲೇ ಅವ್ರು ಇರೋದ್ರಿಂದ ಅವರು ನಮ್ಮ ಸಂಸ್ಥೆಗೆ ಬಂದ್ಬಿಟ್ಟು ಒಂದ್ಸತಿ ಪರೀಕ್ಷೆ ಮಾಡಿಸ್ಕೊಳ್ಳಿ. ಇಲ್ಲಿ ಎಲ್ಲರೂ ಸಿಗ್ತಾರೆ ಅವ್ರಿಗೆ, ಸೈಕಾಲಜಿಸ್ಟು, ಸ್ಪೀಚ್ ಪೆಥಾಲಜಿಸ್ಟು ಮತ್ತೆ ಆಕ್ಯುಪೇಷನಲ್ ಥೆರಪಿಸ್ಟು, ಅವರೆಲ್ಲರೂ ಒಂದ್ಸತಿ ನೋಡಿ ಕನ್ಫರ್ಮ್ ಮಾಡಿ ನಂತರ ನಿಮ್ಗೆ ಹೇಳ್ತಾರೆ.
ಓಕೆ ಓಕೆ ಥ್ಯಾಂಕ್ ಯು.
ಇನ್ನೇನಾದ್ರೂ ಕ್ವೆಶನ್ ಇದೆಯಾ?
ಇಲ್ಲ, ಇಷ್ಟೇ ಇದ್ದಿದ್ದು. ಜಸ್ಟ್ ಅಷ್ಟೊಂದು ಸೋಷಿಯಲ್ ಇಲ್ಲ ಅಲ್ವಾ, ಸೊ ಅದಕ್ಕೋಸ್ಕರ ಲೈಕ್ ಒಂದು ಡೌಟ್ ಇತ್ತು, ಅದಕ್ಕೋಸ್ಕರ.
ಓಕೆ ಮ್ಯಾಮ್ ಹೇಳ್ದಂಗೆ ಕರ್ಕೊಂಡು ಬನ್ನಿ ಇಲ್ಲಿಗೆ. ಪೂರ್ತಿ ಪರೀಕ್ಷೆ ಮಾಡಿ ನಂತರ ನಾವು ನಮ್ಮ ಸಜೆಷನ್ಸ್ನ ಹೇಳ್ತೀವಿ.
ಓಕೆ
ಕರೆ ಮಾಡಿದ್ದಕ್ಕೆ ಧನ್ಯವಾದಗಳು.
ಓಕೆ ಮ್ಯಾಮ್.
Ma'am, coming back to the question, and now we had a call also. 3-4 years has already been over, so I'm sure they don't know whom to consult.
Right. So, like I was saying, even before 1 year of age or 2 years of age, because the parents are in regular contact with their pediatricians, they should definitely voice out their concerns to the pediatrician, because they are almost like the first point of contact among the professionals. And if the concerns are voiced out to the pediatrician, they will surely refer them to the other professionals. And when I say the other professionals, they would include the speech language pathologist. Now, speech language pathologist is an important person who would look at the communication issues, speech and language abilities in the child, okay? And they would do the needful in terms of the assessment and the management. Then the other members would include a clinical psychologist. A lot of these children would also have behavioral problems, so that needs to be assessed. Okay, and like ma'am was saying, an IQ assessment should also be done for all of these children to get an estimate of their intellectual capacity. And most children with autism spectrum disorder could have sensory issues. Okay, so they have a lot of sensory processing difficulties. So because of which an occupational therapist is also an important member of the team. Okay. So even an occupational therapist should be seeing the child to make an assessment, and if deemed necessary, they would also take up the management part of it. Further, the special educator is also involved, especially to take care of the pre-academic and the academic skills which are required for later schooling of this child. Then, depending on the needs of the child, like say suppose there is also a concern about hearing in this child, then an audiologist would come into picture. Similarly, a dietitian or a nutritionist would also be consulted if necessary. But these referrals are all made by the other members of the team.
Okay.
So at least a clinical psychologist or an SLP should be consulted in the beginning.
Okay, thank you. Ma'am, when we see a team, I think family plays a major role, parents play a major role, along with the professionals. So could you please let us know what is the role of the parents in the rehabilitation of children with autism spectrum disorder?
Yes, parents definitely play a very important role. I would rather say family, because of course we don't see many joint families now, but still within a small nuclear family you could see that sometimes the grandparents are there with them. So we have had cases wherein the parents have accepted the problem but the grandparents have not, or vice versa. But what is important for us is, as professionals, we should be able to first make them accept that this is a condition and this probably requires some attention. Okay, otherwise many times, like I said before also, they think that grandparents generally advise and say, no, 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 even you started speaking late, so that's why maybe your son is speaking late, or you were very shy, that's why your son is also probably shy, so it's fine, he's going to be fine. So this is not it. It may not be, because you might really miss out if there is a child with a problem. Okay, so right from creating awareness, which is very much the objective of today's program, we will have to tell them that how different developmentally a child is growing in a child with autism. So it's important for them to know when a child actually learns to smile or start interacting with people, when he recognizes the family members, when he recognizes the others apart from mother and father, when he is able to differentiate between the family and the strangers, or when he is able to understand that there are people who belong to his age group. Okay, so these are things that we have to tell them about social development. Okay, so this is one aspect to it. The other aspect to it is definitely letting them know about how their speech language development is supposed to be, because it's a milestone. Okay, so you have developmental milestones right from when a baby is born, and how the baby starts to babble, around 4 to 5 months, and then the baby starts differentiating. So you have different types of babbling to convey different meaning. You have different types of prototypers, which comes very close to 10 months of age, and then they start coming out with a meaningful word by 12 months. So at times it has been seen that boys do have a little delay when compared to the girls, but still we don't expect that a child is not speaking till 2 years of age or till 3 years of age, which is definitely a delay. So these are some of the developmental milestones that they are supposed to be aware of. Emotional development. Okay, many of them think that what would the child understand with respect to emotions? It's not so. Children have evolved now compared to what we were before. So children do understand what is sarcasm very early in life. They understand what is humor. I'm talking about emotions beyond anger and happiness and sadness and things like that. So they've moved ahead. Okay, so they have even the higher level meta cognitive skills right now. So that is what I'm trying to say. The parents need to be aware of these developmental aspects in the first place. The other thing, most important, is like Dr. Priya was saying, getting into the hands of the right professionals. Okay, so please don't get into quacks. There are people who will tell you that if you give this herbal medicine, the child is going to start speaking, or the child will start, doing maths very quickly. Okay, I'm just giving instances. It does happen, and they spend lots of money and time on this. This should not happen. So, like she said, the first point of contact is definitely your pediatrician, because a developmental pediatrician for sure knows that the child needs to be assessed by a psychologist first, and then the psychologist will assess the child, and then the speech language pathologist, then the occupational therapist. So there are various professionals who are involved, so you need to go into the hands of the right professionals. We are reiterating the names of the professions mainly because we want all of you to know that there are professionals available to cater to these children. Okay, so assessment is very important. It should not be that there is an overdiagnosis or underdiagnosis. So get it done from the right profession, and then definitely follows your rehabilitation. So what they have to understand is this whole rehabilitation process is not really like your dosage for drugs, medicines. It's not that you give it for 5 days and then everything is sorted. It is a long-term process. They need to understand. The parents have to be patient. They have to be calm. They have to give the child as much support as possible. But eventually, it's always better that they accept that the child has a problem. The moment they accept that, I think the rest of the things will just follow, because science has moved far ahead now. There is probably solution for almost everything right now. You just need to explore and find out. So parents play a very important role right from observing the child for the milestones at home, getting the child assessed from the right professionals, and getting the child rehabilitated, and understand that it is definitely going to be a long-term process.
Yes, ma'am. True, because acceptance is the one. I think not everybody in the family would do that. And generally, we tend to see only mothers getting children over here. And many don't even support the mother. And they have a different approach towards the child. Each one of them have a different approach. So that again will create a confusion for the child during the development. So, as ma'am suggested, we request that everybody do accept and please be a part of the rehabilitation team. Yes, ma'am. So now, after this rehabilitation, can these children go to a normal school, and what are the options of schooling for them?
Talking about schooling, it is not that they go to a school after the rehabilitation, it can happen simultaneously as well. But then a lot depends on the abilities of a child. Okay? So it totally depends on the child, the severity of the problem in the child, and those factors would decide whether a child will be able to go to a regular mainstream school or not. Most children with autism can do that. It is not that they cannot be sent to the normal school, but they need to have adequate intellectual capacity for that. Okay? They need to have verbal abilities also. It depends on their academic skills and whether they can cope up in a gathering, that is in a group of people. Can they get along with the peers? Because it's not just about sending the child to the school. The school also need to have facilities or accommodations to cater to the needs of the child. And like we previously said, these children have a lot of sensory issues, and those only get exaggerated in a typical school setup. Okay? So depending on these factors, it is possible, and we have seen a lot of children who are attending therapy in our institute also, they are going to the normal schools and they are able to cope up. But as the severity of the problem increases, it's very likely that they have a lot of comorbidities. They could have intellectual disabilities, the extent of the sensory processing problems could be much higher, the social and emotional problems could be much higher. So in those cases, normal school might not be the right place for them. But that does not mean it's the end of the world. There are again other options. Even within a normal school, you have different types of educational setting. It could be like a full inclusion or an integration. So, which means to say that a child with a disability, not just autism, anything, can be studying or they will be studying with the typical peers throughout. There is no difference in whatever aspects it is at school. Okay, so they are just doing it along with the typically developing children. Or it could be like a partial integration. That is, for most subjects, they might be doing it with the typical peers, whereas they might also be getting some additional support in the form of support from a SLP or a speech language pathologist in the school or a resource teacher in the school. Some additional resource room activities could be done for them. So such additional support is also possible. And then there is also the option of open schools for them. Okay, and currently, like otherwise, if the problem and the severity is much higher, then one would have to consider placing the child in a special education setup, because in that case a normal school might not be a good option considering the child. Okay, and also these days the concept of homeschooling is gaining a lot of momentum. Of course, it's not so much in India as of now, but yes, that could also be considered as an option for these children in the time to come. Along with homeschooling, there is also something called as unschooling, okay, which is like a child-led learning, where the learning completely happens based on the interest of the child, because especially the children on the spectrum are very curious. They might not be curious about everything, but they have their own special vested interests. Okay, they have interest, too much of interest on certain aspects, and they might want to learn more about that. So those things can be supported and facilitated through this. But yes, depending on their abilities, they can definitely be sent to a regular school.
Let's take the comment. Hello, ನಮಸ್ಕಾರ ಹೇಳಿ. ಹಲೋ,
ಹಲೋ,
ಕೇಳಿಸ್ತಿದ್ಯಾ?
ಕೇಳಿಸ್ತಾ ಇದೆ.
ಹೇಳಿ ಮ್ಯಾಮ್, ನಿಮ್ಮ ಪರಿಚಯ ಮಾಡ್ಕೊಳ್ಳಿ, ಹಾಗೆ ನಿಮ್ಮ ಪ್ರಶ್ನೆ ಕೂಡ ಕೇಳಿ.
ಮ್ಯಾಮ್, ನನ್ನ ಹೆಸರು ಕೌಸಲ್ಯ.
ಓಕೆ,
ನನಗೆ ಒಂದು ಕ್ವೆಶ್ಚನ್ ಇತ್ತು.
ಹಾ ಹೇಳಿ.
ಈಗ ಆಟಿಸಮ್ ಅಂತ ಡಿಸಾರ್ಡರ್ಗೆ ಏನಾದರೂ ಮೆಡಿಸಿನ್ ಕೊಟ್ಟು ಇಲ್ಲ ಅಂತ ಏನಾದರೂ ಕ್ಯೂರ್ ಆಗೋದಕ್ಕೆ ಏನಾದರೂ ಮಾಡ್ಬೋದಾ ನಾವು?
ಈಗ ನಮ್ಮ ಎಕ್ಸ್ಪರ್ಟ್ಸ್ ಹೇಳಿದ್ರು ಮೆಡಿಸಿನ್ ಇಂದ ಇದು ಏನು ಆಗೋದಿಲ್ಲ. ಆ ಥರ ಎಲ್ಲರೂ ನಿಮ್ಮ ಅಡ್ವರ್ಟೈಸ್ಮೆಂಟ್ ನೋಡ್ತೀರಾ ಅಂತಂದ್ರೂ ಅದನ್ನ ನಂಬಕ್ ಹೋಗಬೇಡಿ. ನಮ್ಮ ಎಕ್ಸ್ಪರ್ಟ್ಸ್ ಅದ್ರ ಬಗ್ಗೆ ಇನ್ನೊಂದಿಷ್ಟು ಹೇಳ್ತಾರೆ. ಮ್ಯಾಮ್,
ಈಗಾಗಲೇ ನಾವು ಹೇಳ್ತಾ ಇದ್ವಿ ಮ್ಯಾಮ್, ಆಕ್ಚುಲಿ ಮೆಡಿಸಿನ್ಸ್ ಫಸ್ಟ್ ಆಫ್ ಆಲ್ ಇದು ಕ್ಯೂರ್ ಆಗುವಂಥ ಕಂಡೀಷನ್ ಅಲ್ಲ, ಆಯ್ತಾ? ಸೊ ಇದು ಮೆಡಿಕಲಿ ನೀವು ಟ್ರೀಟ್ ಮಾಡ್ಬೋದು ಅನ್ನೋವಂಥದ್ದು ಇಲ್ಲ. ಅಂದರೆ ಮೆಡಿಸಿನ್ಸ್ ಕೊಟ್ಬಿಟ್ಟು ಇದನ್ನ ಸರಿಪಡಿಸ್ಬೋದು ಅನ್ನೋವಂಥದ್ದು ಅದು ಸರಿಯಾದ ನಂಬಿಕೆ ಅಲ್ಲ. ಇದಕ್ಕೆ ಖಂಡಿತ ಥೆರಪಿಗಳು ಬೇಕಾಗ್ತವೆ. ಅದು ಆಕ್ಯುಪೇಷನಲ್ ಥೆರಪಿ ಇರ್ಬೋದು, ಅಥವಾ ಸ್ಪೀಚ್ ಥೆರಪಿ ಇರ್ಬೋದು, ಅಥವಾ ಬಿಹೇವಿಯರಲ್ ಥೆರಪಿ ಇರ್ಬೋದು. ಈ ರೀತಿಯಾದ ರಿಹ್ಯಾಬಿಲಿಟೇಷನ್ ಒಂದು ಪ್ರಾಸೆಸ್ ಇರುತ್ತೆ ಇದಕ್ಕೆ.
ಓಕೆ,
ಬೇರೆ ಏನಾದ್ರು ಪ್ರಶ್ನೆ ಇತ್ತಾ?
ಇಲ್ಲ ಮ್ಯಾಮ್, ಅಷ್ಟೇ. ಥ್ಯಾಂಕ್ ಯು.
ಕರೆ ಮಾಡಿದ್ದಕ್ಕೆ ಧನ್ಯವಾದಗಳು. ಓಕೆ ಮ್ಯಾಮ್, ಈಗ ಡಾಕ್ಟರ್ ಪ್ರಿಯಾ ಅವ್ರು ಹೇಳ್ತಾ ಇದ್ರು ನಾರ್ಮಲ್ ಸ್ಕೂಲಿಂಗ್ ಅಥವಾ ಡಿಪೆಂಡಿಂಗ್ ಅಪಾನ್ the severity of the problem, they can opt for different schooling option. So the role of teachers and the peer group play a very important role. So about that, so if you can tell the public, especially the teachers and the peer group, but because we hear a lot from the patients saying that the child is being discriminated at the school, and that would obviously have an impact, psychological impact on the child as well as the parent. So if you could suggest or tell them how they have their role is actually in this, so that would be really helpful.
ಎಸ್, ಈಗ ನಾನು ಆಗಲೇ ಹೇಳ್ತಾ ಇದ್ದೆ, ಮನೆಯಲ್ಲಿರುವಾಗ ಪೇರೆಂಟ್ಸ್, ಎಸ್ಪೆಷಲಿ ಫ್ಯಾಮಿಲಿ ಮೆಂಬರ್ಸ್, ವಾಟ್ ಆರ್ ದೇ ಸಪೋಸ್ ಟು ಬಿ ಡೂಯಿಂಗ್? Now coming to school, now after 3 years, you know that the child, if not for a formal schooling, he's still getting into an informal schooling, right? So preschool teachers have to look out for some of the signs that I was talking to you about. And I would rather say that a lot of identification starts from the school level itself. Teachers are, even though they may not be rehabilitation professionals, but they're very observant of the children who are there in their classrooms. So they know that if there are, say, 20-25 children in their preschool, and one child is behaving differently, they know that there's something wrong. So they can look out for certain red flags, which we were talking about. And it's important that you communicate it to the parents. A lot of times what happens is teachers do identify, they know there is something wrong, but at times due to their own school policies or their own administrative policies or their own fear of not knowing how to handle this, it does not get conveyed to the parents. So I would suggest that the teachers should be very active in basically observing and then communicating the whole thing to the parents. Okay, that it doesn't stop there. Okay, that's one important step. But the other important aspect to this is how they're accepting the child in the classroom. I think all of us being in speech and hearing, we know very well how there are a lot of schools outside. I would not say all of them. There are many schools who are very cooperative, very understanding. But there are a lot of schools who have still not accepted these conditions. And because they don't accept the conditions, they don't understand that they can be included in the regular school, which they definitely can. Okay, so we are all talking about creating an inclusive environment for autism, but we are not accepting it. So this does not go in sync at all. So teachers should understand that these children learn differently. They have a different learning style. Probably the other children have one common learning style, but these children learn differently. And like we already said, there can be a lot of children who can be high functioning also, who can do extremely well, compared to the other children and over and above their age. So you can find varieties of them, varieties of learning styles in children with autism. Teacher who is definitely conscious about their duties will definitely know that, okay, this child has some problem, but how can I help this child? Okay, there have been wonderful teachers who have spent time even after their school hours. We have live examples here in our institute itself, and because of whom the children have come out with flying colors. There have been a lot of them who are doing movies. There have been a lot of them who models. There have been a lot of them who are musicians. There are a lot of them who are working as engineers. So they can definitely be trained quite well, just like the other children. But I guess it's the duty of the teachers to create an accepting environment. Okay, so the moment you serve as a model, that other children in the classroom are definitely going to follow that. They will not treat this child differently. That is the whole idea. We don't want the child to be treated differently. Let him be treated as per his, as per how he is in the classroom, in the peer group. Okay, not creating a completely different environment. So that's the whole idea about the theme today as well. Okay, we definitely need to create an inclusive environment and ensure how well it can be translated into school setups and work environments and so on. Yeah.
Ma'am, till now, we started with the infancy where parents can identify and what is their role, their importance in the rehabilitation and the development of the child. Then we came to schooling. So, ma'am said how parents, sorry, teachers and the peer group play an important role. And the very toughest time of everybody's life is the adolescence. So when we say the common man, only the adolescent age is very difficult for any parent to take care of the child. And even children with autism also go through that phase of life. And what is your suggestion to the parents as well as when they come to this adolescence age? It is not only teachers, peer group, they also start interacting more with the public. So public also have to accept them.
Yes.
So that is, as ma'am said, that is the theme of this
Awareness.
year's
Yes.
awareness. So ma'am, if you could please address the public as well as the parents.
Adolescence, as you mentioned, is a very crucial period with or without autism. So, as a parent, as a professional, I can tell that. Okay, so because that is a very sensitive period of development as well. There are a lot of changes that's happening in terms of their behavior, their communication.
Yes.
Okay, that is a stage of transition where they are neither considered as young children nor are they completely adults. So that is a time when they are constantly making changes within themselves to kind of establish a unique identity. That happens in the typical children
Yes.
as well. And the struggle in that period is definitely much more when it comes to children who are on the spectrum, because they are already considered different. And then even in the normal developmental sequence or with the typical peers also, adolescence is a period when they tend to become relatively aloof compared to how they were previously. They want their own space. They try to minimize their interactions with the adults or very young children. They look for establishing stronger friendships within their age group. Okay, so strong peer relationships are established at that age. And that is the domain which is very difficult for children who are on the spectrum.
Correct. And we'll just take this call. Hello. ಹಲೋ ನಮಸ್ಕಾರ ಹೇಳಿ.
ನಮಸ್ಕಾರ.
ಹೇಳಿ, ನಿಮ್ಮ ಪರಿಚಯ ಮಾಡ್ಕೊಳ್ಳಿ, ಹಾಗೆ ನಿಮ್ಮ ಪ್ರಶ್ನೆ ಕೂಡ ಕೇಳಿ.
ಹಾ, ನಾನು ಪದ್ಮಾ ಅಂತ ಚಾಮರಾಜನಗರದಿಂದ ಕಾಲ್ ಮಾಡ್ತಾ ಇರೋದು.
ಹಾ, ಹೇಳಿ.
ಇದು ನಮ್ಮ ಊರಲ್ಲಿ ಕೆಲವು ಮಕ್ಕಳು ಬುದ್ಧಿ ಕಮ್ಮಿ ಇದೆ. ಸೊ ಅದು ಮತ್ತೆ ಆಟಿಸಮ್ ಎರಡು ಒಂದೇನಾ ಅಥವಾ ಬೇರೆ ಬೇರೆನಾ? ಅದನ್ನ ಹೇಗೆ ಬೇರೆ ಬೇರೆ ಅಂತ ಗೊತ್ತಾಗುತ್ತೆ?
ಹಾ, ನಮ್ಮ ಜೊತೆ ಎಕ್ಸ್ಪರ್ಟ್ಸ್ ಇದ್ದಾರೆ, ಅವ್ರು ನಿಮ್ಗೆ ಹೇಳ್ತಾರೆ.
ನಮಸ್ಕಾರ ಪದ್ಮಾ ಅವರೇ.
ನಮಸ್ಕಾರ.
ನೀವು ಕೇಳ್ತಾ ಇರೋದು ಆಟಿಸಮ್ ಮತ್ತೆ ಬುದ್ಧಿಶಕ್ತಿ ಕಡಿಮೆ ಇರುವಂತದ್ದು, ಅಂದ್ರೆ ಬುದ್ಧಿಮಾಂದ್ಯತೆ ಅಂತ ಹೇಳ್ತೀವಿ. ಇವೆರಡು ಒಂದೇನಾ ಬೇರೆ ಬೇರೆನಾ ಅಂತ ಅಲ್ವಾ?
ಹೌದು.
ಇದೆರಡು ಬೇರೆ ಬೇರೆನೆ. ಆದ್ರೆ ಕೆಲವೊಂದು ಸಂದರ್ಭಗಳಲ್ಲಿ ಕೆಲವು ಮಕ್ಕಳಿಗೆ ಈ ಎರಡು ಕಂಡೀಷನ್ಸ್ ಒಂದೇ ಮಗುವಲ್ಲಿರುವಂತ ಸಾಧ್ಯತೆನೂ ಇರುತ್ತೆ. ಓಕೆ, ಬಟ್ ಅದನ್ನ ಗುರ್ತು ಹಿಡಿಯೋದು ಹೇಗೆ ಅಂತ ಹೇಳಿದ್ರೆ ಅದಕ್ಕೆ ಸರಿಯಾದ ಪರೀಕ್ಷೆ ಫಸ್ಟ್ ನಾವು ಮಾಡಿಸ್ಬೇಕು. ನೀವು ಹೇಳ್ತಾ ಇರೋವಂಥ ಮಕ್ಕಳನ್ನ ಸೈಕಾಲಜಿಸ್ಟ್ ಮತ್ತು ವಾಗ್ಭಾಷಾ ತಜ್ಞರ ಹತ್ರ ಕರ್ಕೊಂಡು ಬಂದರೆ ಅವರು ಬೇಕಾಗಿರುವಂಥ ಪರೀಕ್ಷೆಗಳನ್ನು ಮಾಡಿಬಿಟ್ಟು ಏನು ತೊಂದರೆ ಇದೆ ಮಗುಗೆ ಅಂತ ಎಕ್ಸಾಕ್ಟ್ಲಿ ಹೇಳ್ತಾರೆ. ಓಕೆ, ನಾ ಮೊದಲೇ ಹೇಳ್ದಂಗೆ ಎಲ್ಲ ಆಟಿಸಮ್ ಇರುವಂಥ ಎಲ್ಲ ಮಕ್ಕಳಿಗೂ ಬುದ್ಧಿಶಕ್ತಿ ಕಡಿಮೆ ಇದೆ ಅಂತಲ್ಲ. ಇನ್ಫ್ಯಾಕ್ಟ್ ಈ ಮಕ್ಕಳಲ್ಲಿ ನಾವು ಬುದ್ಧಿಶಕ್ತಿಯನ್ನು ಪರೀಕ್ಷೆ ಮಾಡೋದು ಕೂಡ ಒಂದು ಚಾಲೆಂಜ್. ಆಯ್ತಾ, ತುಂಬ ಸರಳವಾಗಿ ನಾವು ಅವರಲ್ಲಿ ಬುದ್ಧಿಶಕ್ತಿನ ಪರೀಕ್ಷೆ ಮಾಡೋದಕ್ಕೂ ಕಷ್ಟ ಆಗುತ್ತೆ. ಬಟ್ ತಜ್ಞರ ಹತ್ರ ಕರ್ಕೊಂಡು ಬಂದರೆ ಅವ್ರು ಬೇಕಾಗಿರುವಂಥ ಪರೀಕ್ಷೆನ ಮಾಡಿ ಕರೆಕ್ಟ್ ಡಯಾಗ್ನೋಸಿಸ್ ಕೊಟ್ಟು ಮುಂದಕ್ಕೆ ಏನು ಮಾಡಬೇಕು ಅಂತ ಹೇಳೋ ಮಾರ್ಗದರ್ಶನ ಕೂಡ ಕೊಡ್ತಾರೆ. ಪ್ರಾಬ್ಲಮ್ ಅದ ಲೆವೆಲ್ ಜಾಸ್ತಿ ಆಗ್ತಿದ್ದಂಗೆ ಎರಡು, ಈಗ ಬುದ್ಧಿಮಾಂದ್ಯತೆ ಇರುವಂಥ ಮಕ್ಕಳು ಮತ್ತು ಆಟಿಸಮ್ ಇರುವಂಥ ಮಕ್ಕಳಲ್ಲಿ ಸುಮಾರು ಸಿಂಪ್ಟಮ್ಸ್ ಒಂದೇ ರೀತಿ ಇದೆ ಅಂತ ಅನ್ಸಕ್ಕೆ ಶುರು ಆಗುತ್ತೆ. ಬಟ್ ನೀವು ಪ್ರೊಫೆಷನಲ್ಸ್ ಹತ್ರ ಕರ್ಕೊಂಡು ಬಂದರೆ, ಅಂದರೆ ಸೂಕ್ತ ತಜ್ಞರ ಹತ್ರ ಕರ್ಕೊಂಡು ಬಂದರೆ ಅವರು ಅದನ್ನು ನಿಮಗೆ ಎಕ್ಸಾಕ್ಟ್ಲಿ ಏನು ತೊಂದರೆ ಇದೆ, ಮಗುಗಿರುವಂಥ ಸಿಂಪ್ಟಮ್ಸ್ ಆಟಿಸಮ್ ಕಡೆ ಜಾಸ್ತಿ ಇದೆಯಾ ಅಥವಾ ಬುದ್ಧಿಮಾಂದ್ಯತೆ ಇದೆಯಾ ಮಗುವಲ್ಲಿ ಅಂತ ಹೇಳೋದನ್ನ ಖಂಡಿತ ನಿಮಗೆ ತಿಳಿಸೋದಕ್ಕೆ ಸಾಧ್ಯ ಆಗುತ್ತೆ. ನಿಮ್ಮ ಪರಿಚಯದಲ್ಲಿ ಆ ಥರ ಮಕ್ಕಳಿದ್ರೆ ಖಂಡಿತ ಅವ್ರನ್ನ ತಜ್ಞರ ಹತ್ರ ಕರ್ಕೊಂಡು ಬನ್ನಿ, ಪರೀಕ್ಷೆಗಳನ್ನ ಮಾಡಿಸಿ ಸೂಕ್ತವಾದ ಮಾರ್ಗದರ್ಶನನ ಪಡ್ಕೊಳ್ಳಿ.
ಸರಿ ಸರಿ, ಖಂಡಿತ. ಥ್ಯಾಂಕ್ ಯು.
ಧನ್ಯವಾದಗಳು ಕರೆ ಮಾಡಿದ್ದಕ್ಕೆ. Ma'am, continuing.
Yeah, so we were talking about the
adolescent period,
and
yes.
how it's very crucial, and how even normal children would tend to become slightly aloof. And
Yes.
I said even children who are on the spectrum are not different. They are already having difficulties with communication, and it definitely is a struggle for them to understand the changes that they are undergoing during that period. Because adolescence is definitely a time where there are physical changes, there are a lot of bodily changes. Children undergo puberty during that time, and children on the spectrum might find it very challenging, very difficult to accept those changes, to understand what really is happening and cope up with that. So not just like you mentioned, the family members or the teachers, everybody has an important role in supporting the children in this crucial period. And when it comes to the public, definitely we talk about inclusion, okay? But the sad part is that every time we say inclusion, we are trying to change these individuals with a problem to fit into the society. But the trend is definitely seeing a change now, although there's a lot more to be done. So it's to say, why not accept them as they are? Okay, they come with a lot of differences, but those differences are not to be seen as deficits, right? So we accept them and include them. So if we could also undergo certain changes in our approach, in the way we look at them, we deal with them, okay, we respect them. So with all these, the awareness of the public should be increased about all these aspects, and that would make it a lot more easier for them to accept the individuals and their families with autism. Okay, so when that happens, there is a lot of emotional support for the caregivers of these children as well as their family members. So the public can definitely be a bigger support system if they are making themselves aware about the condition, these children, their challenges, their strengths, and learn to accept them with their differences. Probably that should help.
Yes, I agree. Ma'am, when it comes to public, again, post-schooling, the job opportunities. So readily, the acceptance at the workplace is also a very difficult aspect. So what are the post-schooling opportunities for children with autism spectrum disorders, and what job opportunities are available for them?
Yes, job opportunities is something that we as rehab professionals are also supposed to think about. Okay, so our job does not stop when we finish our speech therapy or we discharge them from our sessions. Okay, so it's a lifelong process basically. So why I'm saying that rehab professionals are very important key people involved for selecting appropriate jobs for them is, like I said, these children are in the spectrum. They can have different abilities. A lot of these children can have very special abilities. Okay, so which we call as painter skills. So many times these children, you might have seen that some of these children learn lyrics very fast.
Yes.
They have some very good auditory memory, and so is their expression. Okay, and I'm sure a lot of you must have heard of this movie called My Name is Khan, where Shah Rukh Khan finds it very difficult to basically socialize with people, but then he's very good at doing things, especially the mechanical things and anything to do with machines and equipments and so on. And he can do it very quickly. So generally, these kids have special abilities like that. I remember of a child who used to remember chemical formulae very young in age. Though the child could not speak much, but the child could sort out the chemical formula very easily. Okay, so should we take the call?
Yes, I will just take and written. ಹಲೋ, ನಮಸ್ಕಾರ, ಹೇಳಿ. ಹಲೋ,
ಹಲೋ,
ಕೇಳಿಸ್ತಿದ್ಯಾ?
ಕೇಳಿಸ್ತಿದೆ ಮೇಡಮ್.
ಹೇಳಿ ಮೇಡಮ್, ನಿಮ್ಮ ಪರಿಚಯ ಮಾಡ್ಕೊಡಿ, ಹಾಗೆ ನಿಮ್ಮ ಪ್ರಶ್ನೆ ಕೂಡ.
ನನ್ನ ಹೆಸರು ಪವಿತ್ರ ಅಂತ. ನಿಮ್ಮ ಮಗನ ಹೆಸರು ರಚಿತ್ ರೆಡ್ಡಿ.
ಹಾ,
ಅವ್ನು ಪ್ಯೂರ್ ಆಟಿಸಮ್ ಟೀಚರ್.
ಓಕೆ.
ನಿಮ್ದು 5.6 ಇಯರ್ಸ್ ಅವನಿಗೆ.
ಹಾ,
ಅವನು ಏನೂ ಮಾತಾಡ್ತಿಲ್ಲ, ಲೆಟರ್ಸ್ ಕೂಡ ಮಾತಾಡ್ತಿಲ್ಲ. ಅವನು ಎಷ್ಟು ಸ್ಟಿಮ್ಯುಲೇಟ್ ಮಾಡಿದ್ರು ಬಾಯೇ ಬಿಡ್ತಾ ಇಲ್ಲ.
ನೀವು ಅವನ್ನ ತಜ್ಞರ ಹತ್ರ ಕರ್ಕೊಂಡು ಹೋಗಿರ್ಲಿಲ್ವಾ?
ಇಲ್ಲ, ಎಲ್ಲಾ ಕಡೆ ಇಲ್ಲಿ ಸ್ಪೀಚ್ ಎಲ್ಲ ತಗೊಂಡಿದೀವಿ, ಆಯುಷ್ ಅಲ್ಲೆಲ್ಲ ಹೊರಗಡೆನೂ ತಗೊಂತಾ ಇದೀವಿ ಸ್ಪೀಚ್. ಆಕ್ಟಿವಿಟೀಸ್ ಸ್ವಲ್ಪ ಮಾಡ್ತಾನೆ, ಅಟೆನ್ಷನ್ ಆಕ್ಟಿವಿಟೀಸ್ ಆ ತರದ್ದು. ಸ್ವಲ್ಪ ಕಮೆಂಟ್ಸ್ ಫಾಲೋ ಮಾಡ್ತಾನೆ, ಸ್ಪೀಚ್ ಏನಿಲ್ಲ.
ಇನ್ನೂ ಮಾತಾಡ್ತಾ ಇಲ್ಲ ಅನ್ನೋದು ನಿಮ್ಮ ಇದು. ನಮ್ಮ ಜೊತೆ ಎಕ್ಸ್ಪರ್ಟ್ಸ್ ಇದ್ದಾರೆ.
ಮ್ಯಾಮ್ ನಮಸ್ಕಾರ,
ಕೇಳಿಸ್ತಿದ್ಯಾ?
ಹಾ, ಕೇಳಿಸ್ತೀವಿ.
ನೀವು ಯಾವಾಗಿಂದ ಥೆರಪಿ ತಗೊಂಡ್ರೆ, ಯಾವಾಗ ಕಂಪ್ಲೀಟ್ ಆಯ್ತು ನಿಮ್ಮ ಥೆರಪಿ?
ಈಗ ತಗೋತಾನೆ ಇದೀವಿ ಮೇಡಮ್. ಈಗ
ಯಾವಾಗಿಂದ ತಗೋತಿದ್ದೀರಾ? ಎಷ್ಟನೇ ವಯಸ್ಸಿಂದ?
ಅವನಿಗೆ 4 ವರ್ಷ ಇದ್ದಾಗಿಂದ ತಗೋತಾ ಇದ್ದೀವಿ.
ಓಕೆ, ನೋಡಿ, ಒಂದೇನ್ ನೀವು ತಿಳ್ಕೊಬೇಕಂದ್ರೆ, ನಾನೀಗ ಆಲ್ರೆಡಿ ಹೇಳ್ತಾ ಇದ್ದೆ, ಇದು ಒಂದು ಲಾಂಗ್ ಟರ್ಮ್ ಪ್ರಾಸೆಸ್, ಆಯ್ತಾ? ಈ ಮಕ್ಕಳಿಗೆ ಸಾಮಾನ್ಯವಾಗಿ ಇದರಲ್ಲಿ ಡಿಲೇ ಇರುತ್ತೆ, ಆಯ್ತಾ? ಅಂದ್ರೆ ಬೇರೆ ಮಕ್ಕಳ ತರ ಇವರು ಮಾತಾಡಕ್ ಪ್ರಾರಂಭ ಮಾಡಿರೋದಿಲ್ಲ 1 ವರ್ಷ ಅನ್ನೋಷ್ಟರಲ್ಲಿ. ಅದು ಮಾತಿಗೆ ಅಷ್ಟೇ ಸಂಬಂಧಪಟ್ಟಿರುವಂತದ್ದು ಇರೋದಿಲ್ಲ. ಇದ್ರ ಜೊತೆಗೆ ಆ ಮಕ್ಕಳು ಸೋಷಲೈಸ್ ಮಾಡ್ತಿರೋದಿಲ್ಲ. ಕೆಲವು ಮಕ್ಕಳಿಗೆ ಅಸೋಸಿಯೇಟೆಡ್ ಇಂಟೆಲೆಕ್ಚುಯಲ್ ಡಿಸಬಿಲಿಟಿ ಇರ್ಬೋದು. ಇನ್ನ ಕೆಲವು ಮಕ್ಕಳಿಗೆ ಈ ತರ ಸ್ಟೀರಿಯೋಟೈಪ್ಡ್ ಬಿಹೇವಿಯರ್ಸ್ ಅಥವಾ ಸೆನ್ಸರಿ ಇಶ್ಯೂಸ್ ಇರ್ಬೋದು. ಇವೆಲ್ಲ ಸೇರ್ಕೊಂಡು ಆ ಮಗುಗೆ ಮಾತಿನ ಬೆಳವಣಿಗೆಯಲ್ಲಿ ಅದಕ್ಕೆ ಸ್ವಲ್ಪ ಹ್ಯಾಂಪರ್ ಮಾಡ್ತಾ ಇರುತ್ತೆ. ಸೊ ಅದನ್ನೇ ನಾ ಹೇಳ್ತಾ ಇದ್ದೀನಿ,
ನಾವು ಎಲ್ಲ ಕಡೆಯಿಂದನೂ ವರ್ಕ್ ಮಾಡ್ತಾ ಇದೀವಿ ಮೇಡಮ್. ಓಟಿ ಮತ್ತೆ
ಮಾಡ್ಬೇಕು, ಇನ್ನೂ ಮಾಡ್ಬೇಕು.
ಅಟೆನ್ಷನ್ ಬಗ್ಗೆ.
ಹೌದು ಹೌದು, ಇನ್ನೂ ಮಾಡ್ಬೇಕು. ಈಗ ನನ್ನ ಅಂದಾಜಿನ ಪ್ರಕಾರ ನೀವು 1.5 ವರ್ಷ ಮಾತ್ರ ವರ್ಕ್ ಮಾಡಿರೋದು ಆ ಮಗು ಜೊತೆ, ಅಲ್ವಾ? ಇದು ಖಂಡಿತ ಇನ್ನೂ ಜಾಸ್ತಿ ಸಮಯ ಬೇಕಾಗತ್ತೆ. ಸೊ ಹಾಗಾಗಿ ನೀವು ಕಂಟಿನ್ಯೂ ಮಾಡಿ, ಯಾಕಂದ್ರೆ ನೀವು ಆಯುಷ್ಗೆ ಆಲ್ರೆಡಿ ಬರ್ತಿದ್ದೀರಾ ಅಂತ ಹೇಳಿದ್ರೆ ನೀವು ಕರೆಕ್ಟ್ ಆಗಿರೋ ಒಂದು ಹ್ಯಾಂಡ್ಸ್ ಅಲ್ಲೇ ಇದ್ದೀರಾ. ಪ್ರೊಫೆಷನಲ್ಸ್ ನಿಮ್ಗೆ ಖಂಡಿತ ಹೇಳ್ತಿರ್ತಾರೆ. ಸೊ ಅರ್ಜೆಂಟ್ ಮಾಡ್ಕೋಬೇಡಿ, ನಾಳೆನೇ ನನ್ನ ಮಗು ಸರಿ ಹೋಗ್ಬಿಡ್ತಾನೆ ಅನ್ನೋ ತರ ಇದ್ ಮಾಡ್ಕೊಳ್ಬೇಡಿ, ಎಕ್ಸ್ಪೆಕ್ಟೇಷನ್ ಅಲ್ಲಿ ಇರಬೇಡಿ. ಇನ್ನೂ ಸ್ವಲ್ಪ ಆ ಮಗು ಜೊತೆ ನೀವು ವರ್ಕ್ ಮಾಡ್ಬೇಕಾಗತ್ತೆ. ಜೊತೆಗೆ ನೀವು ಆ ಮಗುನ ಶಾಲೆಗೆ ಸೇರಿಸಿದೀರಾ?
ಇಲ್ಲೇ ಪ್ರೀ
ಸ್ಕೂಲ್ ಅಲ್ವಾ? ಸೊ ಹಾಗಾಗಿ ಅವ್ನು ಇನ್ನೂ ಹೊರಗಡೆ ಸ್ಕೂಲ್ಗೆ ನಾವು ಇನ್ನೂ ಅವನ್ನ ಕಳಿಸಿಲ್ಲ, ರೆಕಮೆಂಡ್ ಮಾಡಿಲ್ಲ. ಇಲ್ಲಿ ಅವ್ನು ರೆಡಿ ಆದ್ಮೇಲೆ ಮಾತ್ರ ನಾವು ಹೊರಗಡೆ ಅವನ್ನ ಸ್ಕೂಲ್ಗೆ ರೆಕಮೆಂಡ್ ಮಾಡ್ತೀವಿ. ಸೊ ಹಾಗಾದ್ರೆ ಅವ್ನು ಇನ್ನೂ ಅದಕ್ಕೆ ತಯಾರಾಗಿಲ್ಲ ಅಂತ ಅರ್ಥ. ಸೊ ಫಸ್ಟ್ ಇದೆಲ್ಲ ಟ್ರೈನಿಂಗ್ ಮುಗಿಸ್ಕೊಂಡ್ಬಿಡಿ. ನೀವು ಎಲ್ಲ ರೀತಿ ಥೆರಪಿ ಮುಗಿಸ್ಕೋಬೇಕು. ಮುಗಿಸ್ಕೊಂಡು ಸ್ವಲ್ಪ ಪೇಷನ್ಸ್ ಇರಬೇಕು, ಅಂದ್ರೆ ಸ್ವಲ್ಪ ಸಮಯ ಆಗುತ್ತೆ ಅನ್ನೋದು ನಿಮ್ಮ ಇದರಲ್ಲಿ ಬರಬೇಕು. ನಿಮಗೆ ಪಾಸಿಟಿವ್ ಪಾಯಿಂಟ್ ಏನಂದರೆ, ನಮ್ಮ ಸಂಸ್ಥೆಯಲ್ಲಿ ಎಲ್ಲ ಪ್ರೊಫೆಷನಲ್ಸು ಜೊತೆಗೆ ಸಿಗ್ತಾರೆ. ನಿಮ್ಗೆ ಎಲ್ಲೇ ಡೌಟ್ ಬಂದರೂ ಕೂಡ ನೀವು ಅವ್ರ ಹತ್ರ ಕ್ಲಾರಿಫೈ ಮಾಡ್ಕೋಬೋದು. ಓಕೆನಾ? ಸರಿ, ಓಕೆ.
ಮತ್ತೆ ಇವನಿಗೆ ಇದು ಆಬ್ಜೆಕ್ಟ್ ನೇಮ್ಸ್ ನೆನಪಲ್ಲಿ ಇರ್ತಾ ಇಲ್ಲ. ಇವಾಗ ಯಾವ್ದಾದ್ರು ಒಂದು ಪ್ಲೇಟ್, ಸ್ಪೂನ್ ಅವ್ನಿಗೆ ಹೇಳ್ಕೊಟ್ರೆ ನಾವು, ಅದು ಎಷ್ಟು ಸರಿ ಹೇಳ್ಕೊಟ್ರೆ ಅದು ನೆನಪಲ್ಲಿ ಉಳಿತಾ ಇಲ್ಲ. ಇದು ಆಪಲ್.
ಮಗು ಇಂಟೆಲಿಜೆನ್ಸ್ ಎಷ್ಟಿದೆ?
ಏನ್ ಹೇಳಿ ಮ್ಯಾಮ್?
ಇಂಟೆಲಿಜೆನ್ಸ್ ಎಷ್ಟಿದೆ? ಐಕ್ಯೂ ಎಷ್ಟಿದೆ?
ಅದ ನೆನಪಿಲ್ಲ ನನಗೆ, ಮರ್ತೋಗಿದೆ, ಬಹಳ ದಿನ ಆಯ್ತದ.
ಇಲ್ಲ, ಅದ್ರ ಮೇಲೇನೆ ಇದೆಲ್ಲ ಡಿಪೆಂಡ್ ಆಗಿರುವಂತದ್ದು, ಆಯ್ತಾ? ನಿಮ್ಮ ಥೆರಪಿಸ್ಟ್ ಇರ್ತಾರಲ್ವಾ, ನಮ್ಮ ಸಂಸ್ಥೆಯಲ್ಲಿ ನಿಮ್ ಥೆರಪಿಸ್ಟ್ ಇರ್ಬೋದು ಅಥವಾ ಸ್ಪೆಷಲ್ ಎಜುಕೇಟರ್ಸ್ ಇರ್ಬೋದು. ಅವ್ರ ಹತ್ರ ನಿಮ್ ಫೈಲ್ ತೋರಿಸಿ, ಅವ್ರಿಗೆ ಗೊತ್ತಾಗುತ್ತೆ. ಅಲ್ಲಿ ಮೆಂಟಲ್ ಏಜ್ ಹಾಕಿರ್ತಾರೆ ಫೈಲಲ್ಲಿ. ಅದನ್ನು ನೀವು ಅವ್ರ ಹತ್ರ ಡಿಸ್ಕಸ್ ಮಾಡಿದ್ರೆ ಖಂಡಿತ ನಿಮಗೆ ಅದ್ರ ಬಗ್ಗೆ ಹೇಳ್ತಾರೆ ಇನ್ನೂ ಯಾಕೆ ಈ ಮೆಮರಿ ಪ್ರಾಬ್ಲಮ್ ಆಗ್ತಿದೆ ಅಂತ. ಹೆಚ್ಚಾಗಿ ಅವರ IQ ಮೇಲೇನೂ ಇದು ಡಿಪೆಂಡ್ ಆಗಿರುತ್ತೆ. ಫಸ್ಟ್ ಅದನ್ನು ತಿಳ್ಕೊಂಡು ಬಿಡೋಣ. ಓಕೆನಾ?
ಓಕೆ,
ಸರಿ,
ಥ್ಯಾಂಕ್ ಯು.
ಹಾಂ, ಧನ್ಯವಾದಗಳು.
ಥ್ಯಾಂಕ್ ಯು.
Yes, ma'am. Coming back to the job opportunities that they can have.
Yes, so I was telling you about the different skills that these
Yes.
children have. So some of them are high functioning. There can be low functioning children also with autism. So what we need to convey to the parents, especially when we give them reports when they are getting into some jobs, is we have to make a detailed profiling of what all skills that they are having currently. Okay, and since we would have observed them for a longer time, so when I say we, I'm not only talking about speech therapists but the team of professionals.
Yes.
So we have to send them in a concise discharge report, especially if you're sending them for any job options and so on, and enlist their skills basically and their strengths and weaknesses and so on. So there are some institutes in Karnataka as well as in other parts of the country. Just to give you one hint, in Mysore, we have JSS Polytechnic College, which is very close to AIISH. So JSS Polytechnic College offers a lot of diploma level courses, and a lot of them which requires hand work. Okay, so they actually train them there, and a lot of our children have been trained there also, and they are also working independently. There have been a lot of livelihood programs which I'm aware of happening in places like HT Kote and Chamarajnagara and so on. There are some NGOs in Bangalore who offer vocational training programs. There are programs in Nanjangud where they offer some programs. So there are a lot of places where they're actually offering these job training programs. And not just these. What I'm just trying to say is there are a lot of them who have also gone into the mainstream. Okay, in the sense we have also seen them getting into professional medical courses or engineering courses or paramedical courses, literature, art. Okay, so it's not that that's why from the beginning I'm saying you don't have to really treat them so differently, because we all being typical also, we don't have all the skills. Each one of us have our own speciality, and we identify that, and that's how our job is opted for, right? So it's just the same with them. So there are a whole basket of jobs available for them. The best thing that I would tell or suggest the parents would be to talk to your professionals. They will, if possible, they will try to find out where the child stands in terms of his skills, and also refer to the appropriate institutes for any kind of special training.
I think at this point, if I may add, parents also have a lot to do in exploring the interests of these children.
Yes.
It is very common that we, kind of get merged with the routine and only certain skills are thought about. But considering these children and their very different interests, it is very essential that you explore a lot of options and see which is the route or which is the path for your child. So parents, and with the help of professionals, should try and first explore that, and then try and take the child in that direction only, based on the child's interest and curiosity.
Yes. Ma'am, in this journey of parent and the child, are there any government policies which would help them to go run this journey a little more smoother?
Yes. Just like how our constitution gives the fundamental rights to every individual, all of that holds good for individuals who are on the spectrum as well.
Yes.
Okay, so everybody needs to be treated equally, with or without disability, no discrimination on any grounds. So that is no different even for those on the spectrum. But along with that, the Rights to Persons with Disability Act, which was passed in the year 2016, definitely gives some additional benefits to these children who are on the spectrum. Previously, before 2016, it was only 7 conditions which were identified as certifiable disabilities. Okay, but in the revised act, or the 2016 RPWD Act, a total of 21 conditions have now been included as certifiable disabilities, and autism spectrum disorder is one among them. So these children can definitely get a disability certificate, which is to be given out by a team of psychologists and psychiatrists. So right now they are the ones to do it, and based on that they are eligible for reservations or right to education. They can get language exemptions. They can get benefits in terms of the railways. That is, they can get free bus passes, railway concessions. So all those benefits. And if it is essential, they could also go ahead and take the help of a scribe for writing their exams if the child is in a mainstream school. So along with this, they do have reservations for higher educations and also in the job sector. So there are definitely certain benefits offered by the government policies, even for those who are on the spectrum.
Thank you, ma'am. And with this, we are coming to the end of this live phone-in program. And I'm sure you all had a very informative session, and it was nice having the two experts with us discussing. And ma'am, with coming to the end of the session, one take-home message for the public who are listening to us and who are watching us.
From the beginning that we were talking about, I think we talked a lot about how acceptance should happen. I think I strongly believe that acceptance is a very important part of any disability. Okay, not just very specific to autism spectrum disorders. That is one thing. Apart from that, there's a significant role of the parents in early identification, and we always say this. Early identification is always the mantra to early rehabilitation, and definitely a lot more success, because I think the more earlier you identify them, the brain plasticity is something that plays a lot of role. So your brain is ready to take in a lot of changes that you do even in the environment. I'm talking about it with respect to training. So these are all scientifically proven facts that I'm trying to tell the public, that please observe these people. They might be in your neighbors, they might be in your family, they might be your own children, they might be children in schools. And if you find any of them like that, and if you suspect, then please advise them to go to the right professionals at the right time.
Thank you, Dr. Jayashree. Dr. Priya, your words for the public for watching us.
I would again reiterate the fact that acceptance is the key, okay? And all of us should be more accepting towards these individuals who are on the spectrum, because it is only a developmental disability. Just to say that their nervous system is slightly different, or I could say they are wired differently, okay? But they do all have all the skills along with their own set of challenges. Can you put the call?
We'll just take this last call. ಹಲೋ ಹಲೋ, ಕೇಳಿಸ್ತಿದೆಯಾ?
ಹಾ, ಕೇಳಿಸ್ತಾ ಇದೆ.
ನಮಸ್ಕಾರ ಮೇಡಮ್, ಹೇಳಿ, ನಿಮ್ಮ ಪರಿಚಯ ಮಾಡ್ಕೊಳ್ಳಿ, ಹಾಗೆ ನಿಮ್ಮ ಪ್ರಶ್ನೆ ಕೂಡ.
ಯಾ, ನನ್ನ ಹೆಸರು ಜಿಶಾ ನಜ್ಮಾ ಅಂತ.
ಹಾ, ಹೇಳಿ.
ನನ್ನ ಮಗು ಸ್ಪೀಚ್ ಅಂಡ್ ಹಿಯರಿಂಗ್ ನಲ್ಲಿ ಪ್ರೀ ಸ್ಕೂಲ್ ಇದೆ. ಮಗುಗೆ ಆಟಿಸಮ್. ಸೊ ಹಾಗಾಗಿ ಮ್ಯಾಮ್, ಆಕ್ಚುಲಿ ಅವನದು ಮದರ್ ಟಂಗ್ ಬಂದು ಉರ್ದು.
ಓಕೆ.
ಬಟ್ ಅವನಿಗೆ ಹಿಂದಿ ಅಂತ ನಾವು ಪ್ರಿಪೇರ್ ಮಾಡಿ ಹಿಂದಿನೇ ಫಸ್ಟ್, ಬಿಕಾಸ್ ಕನೆಕ್ಟ್ ಮಾಡ್ಬೋದು ಅವನು ಮದರ್ ಟಂಗ್ ಜೊತೆ ಅಂತ ಹಿಂದಿಲೇ ಎಲ್ಲ ಸ್ಪೀಚ್ ಎಜುಕೇಶನ್ ಎಲ್ಲ ಸ್ಟಾರ್ಟ್ ಆಗಿದೆ. ಬಟ್ ಅವನಿಗೆ ಇಂಗ್ಲಿಷ್ ತುಂಬಾ ಇಷ್ಟ. ಹಾಗಾಗಿ ಕನ್ಫ್ಯೂಷನ್ ಆಗುತ್ತೆ ಮ್ಯಾಮ್, ಇಂಗ್ಲಿಷ್ ಸ್ಪೀಚ್ ಹಿಂದಿ ಸ್ಪೀಚ್ ಎರಡು ಲ್ಯಾಂಗ್ವೇಜಸ್ ಏನಾದ್ರು ಕಲ್ಸಿದ್ರೆ ಅಂತ.
ಓಕೆ, ನಮ್ಮ ಜೊತೆ ಎಕ್ಸ್ಪರ್ಟ್ಸ್ ಇದ್ದಾರೆ. ಡಾಕ್ಟರ್ ಜಯಶ್ರೀ.
ನಮಸ್ಕಾರ.
ನಮಸ್ಕಾರ ಮ್ಯಾಮ್, ಐಜಾನ್ ಮದರ್.
ಗೊತ್ತಾಯ್ತು ನನಗೆ. ಹೇಗಿದ್ದೀರಾ?
ಯಾ, ಫೈನ್ ಮ್ಯಾಮ್. ನೋ ಕಾದಂಬರಿ ಮ್ಯಾಮ್ ಟೋಲ್ಡ್ ಮೀ. ಐಜಾನ್ ಮ್ಯಾಮ್, ಐಜಾನ್ ತುಂಬಾ ಚೆನ್ನಾಗಿ ಮಾಡ್ತಾ ಇದ್ದಾನೆ ಹಿಂದಿನಲ್ಲೆಲ್ಲಾನು.
ಗೊತ್ತಾಯ್ತು. ಕಂಗ್ರ್ಯಾಚುಲೇಷನ್ಸ್ ಟು ಯು. ನಾನು ನೋಡಿದೆ ಅವನ ಸಕ್ಸಸ್ಸಸ್ ಎಲ್ಲ, ಸ್ಕೂಲೆಲ್ಲ ತುಂಬಾ ಚೆನ್ನಾಗಿ ಮಾಡಿದ್ದಾನೆ. ಈಗ ನಿಮ್ಮ ಪ್ರಶ್ನೆ ಇಂಗ್ಲಿಷ್ ಹೇಳ್ಕೊಡ್ಬೋದಾ ಅಥವಾ ಹೇಳ್ಕೊಡ್ಬಾರ್ದಾ ಅನ್ನೋದು ಅಲ್ವಾ? ಅದೇನಾದ್ರೂ ಕನ್ಫ್ಯೂಷನ್ ಆಗುತ್ತೆ ಅಂತ. ಐಜಾನ್ ನಾನು ನೋಡಿರೋದ್ರಿಂದ ನಾನು ಹೇಳ್ತಾ ಇರೋದು, ಐಜಾನ್ಗೆ ಇಂಗ್ಲಿಷ್ ಇಂಟ್ರೊಡ್ಯೂಸ್ ಮಾಡ್ಬೋದು ಗ್ರಾಜುವಲ್ ಆಗಿ, ಆಯ್ತಾ? ಯಾಕಂದ್ರೆ ಅವನು ಹಲವಾರು ಕಾನ್ಸೆಪ್ಟ್ಸ್ನ ಕಲ್ತಿದ್ದಾನೆ ನಿಮ್ಮ ಮದರ್ ಟಂಗ್ ಅಲ್ಲಿ, ಒಂದು ವಿಷಯ. ಇನ್ನೊಂದೇನಂದ್ರೆ ಅವನ ಕಾಗ್ನಿಟಿವ್ ಸ್ಕಿಲ್ಸ್ ಚೆನ್ನಾಗಿದೆ, ಆಯ್ತಾ? ಸೊ ಹಾಗಾಗಿ ಅವನಿಗೆ ನೀವು ಗ್ರ್ಯಾಜುವಲ್ ಆಗಿ ಇಂಗ್ಲಿಷ್ ವೊಕ್ಯಾಬ್ಲರಿನ ಇಂಟ್ರೊಡ್ಯೂಸ್ ಮಾಡಬಹುದು. ಆದರೆ ಕಂಪಲ್ಷನ್ ಈಗ ಎಲ್ಲ ಮಕ್ಕಳು ಕಲಿತಿದ್ದಾರೆ ಇಂಗ್ಲೀಷು ಅಂತ ಹೇಳ್ಬಿಟ್ಟು ಅವನಿಗೆ ಕಲಿಸೋದು ಬೇಡ. ಬಟ್ ಅವನಿಗೆ ಅವನ ಲೆವೆಲ್ ಚೆನ್ನಾಗಿರೋದ್ರಿಂದ ಅವ್ನು ಇಂಗ್ಲೀಷ್ ಪಿಕ್ ಮಾಡ್ತಾ ಇದ್ದಾನೆ ಅಂಥದ್ದಿದ್ರೆ ಖಂಡಿತ ಅವನಿಗೆ ಇಂಗ್ಲೀಷ್ನ ಇಂಟ್ರೊಡ್ಯೂಸ್ ಮಾಡ್ಬೋದು, ಏನು ತೊಂದರೆ ಆಗಲ್ಲ.
ಸ್ಕೂಲಲ್ಲಿ ಕಮಾಂಡ್ಸ್ ಎಲ್ಲಾನು ಇಂಗ್ಲಿಷ್ ಅಲ್ಲೇ ಹೇಳ್ತಾರೆ ಅಲ್ವಾ ಮ್ಯಾಮ್?
ಹೌದು.
ಹಾಗಾಗಿ ಅವ್ನಿಗೆ ತೊಂದರೆ ಆಗ್ತಾ ಇದೆ. ನಾನು ಅದಕ್ಕೆ ಇದೊಂದು ಡೌಟ್ ಇತ್ತು ಮ್ಯಾಮ್.
ಇಲ್ಲ, ಇಂಟ್ರೊಡ್ಯೂಸ್ ಮಾಡಿಸಿ, ಐಸಾನ ಖಂಡಿತ ಇಂಟ್ರೊಡ್ಯೂಸ್ ಮಾಡಿಸ್ಬೋದು. ಬಟ್ ನಾನು ಪೇರೆಂಟ್ಸ್ಗೆ ಹೇಳೋದು ಏನಂದರೆ, ಇದನ್ನು ನೀವು ಜನರಲೈಸ್ ಮಾಡಬೇಡಿ. ಎಲ್ಲ ಮಕ್ಕಳಿಗೂ ನಾವು ಕಲ್ಸೋಕ್ಕಾಗೋದಿಲ್ಲ. ಅವರ ಒಂದು IQ ಲೆವೆಲ್ ಇರ್ಬೋದು, ಅಥವಾ ಅವರ ಒಂದು ಕಾಗ್ನೇಟಿವ್ ಡೆವಲಪ್ಮೆಂಟ್ ಇರ್ಬೋದು, ಅವರ ಹೋಮ್ ಎನ್ವೈರ್ಮೆಂಟ್ ಅಥವಾ ಸ್ಕೂಲ್ ಎನ್ವೈರ್ಮೆಂಟ್, ಹಲವಾರು ಫ್ಯಾಕ್ಟರ್ಸ್ ಇರುತ್ತೆ ಇದನ್ನು ಡಿಸೈಡ್ ಮಾಡೋಕ್ಕೆ. ಅದಕ್ಕೋಸ್ಕರ ಹೇಳ್ತಾ ಇದ್ದೀನಿ, ಐಸಾನ್ ವಿಷಯದಲ್ಲಿ ಖಂಡಿತ ನೀವು ಇಂಟ್ರೊಡ್ಯೂಸ್ ಮಾಡ್ಬೋದು. ಬಟ್ ಬೇರೆ ಪೇರೆಂಟ್ಸ್ಗೆ ಆ ಥರ ಪ್ರಶ್ನೆ ಇದ್ದರೆ ಖಂಡಿತ ಪ್ರೊಫೆಷನಲ್ಸ್ ಹತ್ರ ಕೇಳಿಬಿಟ್ಟು ನಂತರ ಅದನ್ನು ಇಂಟ್ರೊಡ್ಯೂಸ್ ಮಾಡಿಸಿ. ಯಾಕಂದರೆ ಸುಮಾರು ಜನ ಅನ್ಕೋತಾರೆ ಮಲ್ಟಿಪಲ್ ಲ್ಯಾಂಗ್ವೇಜಸ್ ಕಲಿತ್ರೆ ಒಳ್ಳೆಯದು, ನಮ್ಮ ಮನೆಯಲ್ಲೂ ಮಾತಾಡ್ತಾರೆ, ಹೊರಗಡೆ ಮಾತಾಡ್ತಾರೆ, ಸ್ಕೂಲಲ್ಲಿ ಮಾತಾಡ್ತಾರೆ. ಬಟ್ ಹಾಗಾಗಲ್ಲ ಎಲ್ಲ ಮಕ್ಕಳಿಗೂ. ಓಕೆನಾ?
ಥ್ಯಾಂಕ್ ಯು ಸೋ ಮಚ್.
ಥ್ಯಾಂಕ್ ಯು ಕರೆ ಮಾಡಿದ್ದಕ್ಕೆ.
ಥ್ಯಾಂಕ್ ಯು.
Yes, Dr. Priya.
Yeah, so like I was saying, if acceptance comes in the beginning and with the right support from the parents, family, and the correct team of professionals, definitely it goes a long way in helping the child to realize their full potentials and also lead a life as independent as possible. They are definitely capable of that, and I want the public to be aware of their skills and accept them with their differences.
Thank you so much, Dr. Priya. So with this, I would like to thank both the resource persons for today. And on behalf of our director, All India Institute of Speech and Hearing, Mysuru, we would request the public to have the acceptance of children or individuals with special needs would certainly help them in leading a better quality of life and can be one among us, which is their right as well. So with this, I would like to conclude today's program by thanking our viewers, and we request you all to please join to our next program as well. And for the updates regarding the next event or the program, you can subscribe and follow AIISH Mysuru Facebook page. Thank you.